Hello, students. This is clinical nutritionist and diabetes educator Aditya Khan. So today we'll be discussing about the nutritional management of stress, medical nutritional management of stress. Because we all know regarding the current situation, the pandemic, not only that, but also many other things which is related with our stress. So, if we want to define the stress can be defined as any type of change, like physical, like emotional, like psychological strain. So stress is our body's response to anything that requires attention and action. So what is stress basically? The stress is a diverse, complex phenomenon with various components initiating the triggering events and processing, which is basically the brain to respond. Okay, so everyone experiences stress to some degree. The way you respond to stress, however, makes a big difference to your overall well-being. So, sometimes the best way to manage your stress involving changing your situation. At other times, the best strategy involves changing the way you respond to the situation. So basically, is an adaptive mechanism. In most cases, the adaptation is physiologically appropriate, but in others, it can have pathological consequences. So what is the stressors? Okay, if we talk about the stressors, so stressors are a chemical or biological agent. Okay, if we talk about the environmental condition, external stimulus, or even it's called causing a stress on of an organism. Okay, so if you the stress response, there are a lot of things may include. Okay, first one is the environmental stressors. So environmental stressors basically hypo or hyperthermic temperatures, elevated sound levels, over illumination, and overcrowding. Okay, if you take the daily stress like traffic, loss of keys, money, quality, quantity of physical activity, a lot of things. Okay, if you take up of the life changes, like our life, our personal life. Okay, there may be a divorce, there may be a kind of a what I will say, the problem in the family. Okay, if we talk about the workplace pressures, okay, high job demand versus low job control, repeated or sustained exertion, okay, forceful exertion, extreme work pressure, office clutter, politics, a lot of things are stressors. If we talk about the chemical stressors, so chemical stressors are tobacco, alcohol, drugs. Okay, if we talk about the social stressors, that societal family demands. Okay, family, what I will say, lot of demands. Okay, unwanted demands. So these all are basically the stressors. Okay, so stressor, the psychological stressor, the physical stimulants, and there may be cardiovascular. If you talk about the hemorrhage, orthostatic stress, exercises, heat exposure, so all are included in our stressors. Now, we will talk about the homeostasis, the system. What is the homeostasis system? So basically, all living organisms maintain a complex dynamic equilibrium, or used to say the homeostasis, which is constantly challenged by internal or external adverse effects, which is called the stressors. We have discussed about the stressors. So the stress is defined as a state in which homeostasis is actually threatened, or you might say perceived to be so. Homeostasis is reestablished by a complex, behavioral, sometimes physiological, adaptive responses of the organism. The development of the concept of the homeostasis, they're including lot of things. There may be stresses, there are the other things, so everything. So homeostasis usually refers to the maintenance of the constant environmental internal environment of the body. Okay, so this is all about the homeostasis. Now, what are the reactions of the bodies to stress? Okay, so stress, then body is goes to the specific response, the characteristic of the stressor type, heat, sweating, cold, shivering, exercise, increased heart rate or breathing, non-specific generalized response regardless of type of stressor. We have already discussed about what are the stressors, stress response. So it's a fight or flight. Okay, so basically the stress is all over there on our body, their psychological, physiological there, and also there are some drug also depends during the stress that will come later on. What are the drugs? Now, what is the physiological involvement of the stress response? The nervous system, the endocrine system, and the immune system. Okay, so in the hypothalamus, the pituitary gland, the adrenocorticotropic hormone, and the adrenal glands. In this stressor is not removed, the fight or flight response cannot be maintained for a long period of time. In these circumstances, the hypoxis is activated. Okay, how stress affects to our body. So brain, difficulty concentrating, anxiety, depression, irritability, mood, mind fog, cardiovascular, higher cholesterol, high blood pressure, increased risk of the heart attack and stroke. You might have heard the two come bradycardia, tachycardia, the pulse rate. Joints and muscles, increased inflammation, tensions, pains, muscle tightness. If we talk about our skin, there are hair loss, alopecia, dull or brittle hair, brittle nails, dry skin, acne, delayed tissue repair. If we talk about our gastrointestinal, the side, then gut, nutrient absorption, diarrhea, constipation, indigestion, bloating, pain, and discomfort. So stress affects all over the body. It's not about our brain. It's not stick to our brain, but it's spread all of our body and it's difficult functioning of all of our organs. So it's a very, kind of, I think, question mark that why stress and how to, control and combat with the stress. Now the main thing, the tryptophan function with the serotonin. So this is very, very fantastic, like serotonin. So what is serotonin basically? Serotonin has a wide variety of functions in our human body. Basically is a happy chemical, well-being and the happiness. So if we talk about the serotonin, definitely we have a very good smile in our face. Is a happy face. Okay, it's a mood, good mood. It's a feel good. So everything. Okay, so serotonin means a happier face, a good face, a very rosier face. Okay, so what is serotonin all about? The serotonin, if you talk about the scientific name, serotonin is 5-hydroxytryptamine, 5-HT, 5-hydroxytryptamine. It is mainly present in the brain, bowels, and the blood vessels. Serotonin is a neurotransmitter and some also consider is a hormone. The body uses is to send message between the nerve cells. We know about the nerve cells. If we want to picturize about the nerve cells, the neurons, the actions, the dendrons, the what it is. It appears to play a role in the mood, emotions, appetite, and digestion. As the precursors for the melatonin, it helps regulate the sleep-wake cycles and the body clock. So many investigations have looked at serotonin, what it does basically. So if we talk about the serotonin, and there's a very good friendship with the tryptophan. What is tryptophan basically? Tryptophan is nothing but a amino acids. Okay, so serotonin is a result of tryptophan, a component of proteins combining with the tryptophan hydroxylase, a chemical receptor. Together they form the 5-HT or the serotonin. If we talk about the intestine and the brain produce serotonin, it is also present in the blood platelets, and plays a role in the central nervous system. So there are a lot of research. The research has suggested that the sources of serotonin in other areas, such as the digestive system, may work independently of serotonin in the brain. Okay, so basically, the tryptophan and serotonin both are working together for maintaining our brain function. So that is very important to what else? To controlling our stress basically. Okay, with the peripheral effects, and there are also the central effects. Now there are kind of something which is the depression. Okay, so how depression works and what about the role of the SSRIs for the depression? Okay, if we talk about the SSRIs, they are basically doctor used to prescribe, physicians used to prescribe the SSRI. They are selective serotonin reuptake inhibitors. The basically the, if you want to say the layman language, the antidepressant drug. If you talk about the the fluoxetine, okay, Prozac is a very common example. So normally the body reabsorbs a neurotransmitter after it has transmitted its neural impulse. So SSRIs stop the body from the reuptake serotonin, leaving the higher levels of serotonin to circulate. Many people find serotonin, selective serotonin reuptake inhibitors help relieve their symptoms. Although it is the, what I will say, the link between the depression and the serotonin remains the unclear. Okay, so if you talk about the researchers, they say that while they can measure the serotonin levels in the bloodstream, they cannot measure it the levels in the brain basically. Okay, there are basically in 2015 one editorial called the use of the SSRIs to treat depression. The marketing of is a myth basically. Okay, so serotonin and the tryptophan are basically the working together, and also they are relieving the stress basically. Okay, so that is something is a good sign of the serotonin. Now if we talk about the tryptophan and the blood brain barrier. Okay, what is the blood brain barrier and what is the tryptophan? Basically depends on the blood brain barrier. Okay, so if we talk about the tryptophan and the blood brain barrier, then we can say tryptophan, we know this is the essential amino acids, which is very important for the humans. Okay, so it's requiring that it be ingested since it cannot be made. Okay, so to enter the brain, tryptophan, what will do, must be transported across the blood-brain barrier. So what will do, tryptophan must be transported across the blood-brain barrier by a carrier protein, which is responsible for also transporting the isoleucine, leucine, phenylalanine, tyrosine, and valine. The BCA is also there. So basically, L-tryptophan increases a brain called the serotonin. Some medications for the depressions we already have been discussed. For depression also increase the brain chemical serotonin. So taking L-tryptophan along with this medication for depression might increase the serotonin too much and the cause serious side effects including heart problem, shivering, and the anxiety basically. Okay, so in that cases, these two systems, the blood brain, these two systems are located both sides of the cell membrane. However, the other systems will also be present, but exclusively at the liminal side of the blood-brain barrier. Okay, so in that cases, if we talk about very good language about the blood-brain barrier, neurotransmitter like dopamine, the dopamine is also another neurotransmitter, and serotonin cannot cross the blood-brain barrier because it does not contain the necessary transport mechanism needed to get them across. In that contrast, in some instances, that precursors, the tryptophan amino acid, can cross the blood-brain barrier. So serotonin will work with the help of the tryptophan. Hope it is clear to everyone. Now, the major hormones changes during the stress response. The epinephrine, the fight flight, increased cough, fat availability reinforces the sympathetic nervous system. The cortisol, adrenocorticotropic hormone, mobilize the energy stores, enhance metabolism. The glucagon, insulin, increase the blood glucose level. The angiotensin, conserve the salt H2O, maintain the blood pressures. We all know about the angiotensin converting enzyme inhibitors, the AC inhibitors, the angiotensin receptor blockers, the ARB. We all know about the enalapril, captopril, all the AC inhibitors, and we all know about the telmisartan, olmesartan, all the ARBs. Vasopressin, vasoconstriction increases blood pressures. So the stressors, basically the posterior pituitary, vasopressin, hypothalamus, sympathetic system, adrenal medulla, epinephrine, pancreas, glucagon, insulin, and the adrenocorticotropic hormone. So these are the stressors we already been discussed. So now we regarding the drug, again I'm saying I have only spoke about the Prozac, but the slide says lot of drug, the Celexa, Lexapro, Luvox, Paxil, Zoloft, Vibrib. So these are the generic name. The citalopram, escitalopram, fluoxetine, paraxetine, sertraline. Okay, this all are the This is all are basically the SSRI drugs. Yes. Now, to reduce the stress in our life, what are the foods? The oatmeal fight anxieties, the negative effects. Half an avocado a day should restrict our stress. A handful of walnut is all need to tame stress, because we know these all have the essential amino acids, the vitamins, the B vitamins, all are there. Spinach, broccoli improves our body's response to stress. The blueberry, the raspberry, the wolfberry, these are basically the foreign fruits. But if we talk about the jambrul, kalo jam, like our Bengal fruits, this is also contain a very good amount lutein and zeaxanthin. Eating dark chocolate, there are some advertisements out there, you know, the dark chocolate is a good hormone, feel good hormones. It's good. Water sip the stress away. Definitely fluid balance should be there. 1 glass of a wine can reduce stress. This is not prescribable, but the theoretical knowledge purpose we must know. A glass of warm milk really is coming. In that cases, we should talk about the whole milk, because if we talk about the milk contain a very good amount of the tryptophan that only present in the whole milk. Okay, in that cases, whole milk is a good sources of the tryptophan. If we talk about the omega-3 fatty acids, definitely let's talk about the polyunsaturated fatty acid or eicosapentaenoic fatty acid. That is definitely the PUFA-rich fatty acids, fish oil, flax seeds, chia seeds, all the functional foods, sunflower seeds have a very good amount of this kind of omega-3 fatty acids. But if we talk about the salmon, tuna, herring, mackerel, and Bengal hilsha, but that is very really costly. But if we talk about the rui, katla, mrigal, all the fruits are very minimum amount of omega-3 fatty acids are there, but it's there. The secret of the anti-stress ingredient in the parsley, the vitamin C, all the fruits have contained la musambi, orange, amla, a very good amount of the limonene and the vitamin C, ascorbic acid, definitely is good for the immunity and also at the stress reliever. So we should, take this kind of fruits and foods in our daily life. Thank you so much for your kind cooperation. Please go through the slides. If you have any queries, any question, please reach out with me with the below given mail ID, or reach out with me from the dietetics department, KPC Medical College and Hospital. Thank you.